Hello and welcome to PIT. This is a training for students on returning to campus. The materials in this training are subject to change based on university, public health, and/or government guidance. This training is required. Questions we'll answer. What is the purpose of this training? What is COVID-19? What is PIT doing about COVID-19? What should I do to keep myself and others healthy? What COVID-19 standards and guidelines must I abide by to be on campus during the pandemic? What are the consequences of not following health and safety guidelines? What resources are available on campus? What is the purpose of this training? We are committed to protecting the health and safety of individuals who are working, studying, and researching at the university. This training outlines the University of Pittsburgh's guidance for students throughout the COVID-19 pandemic. This information is intentionally broad and is intended to apply to all university students. What is COVID-19? COVID-19 is a respiratory illness caused by a virus, SARS-CoV-2. SARS-CoV-2 is a new or novel coronavirus. Coronaviruses are an existing group of viruses that generally cause mild to moderate respiratory illness like the common cold. This new coronavirus has spread worldwide and created a new illness called COVID-19. Symptoms vary from person to person and range from no apparent symptoms or asymptomatic to severe illness. All age groups are susceptible to illness or death from COVID-19. Immunocompromised persons are at elevated risk for contracting COVID-19. COVID-19 is primarily spread person to person via respiratory droplets from an infected person's mouth or nose or from respiratory droplets on an infected person's hands. You can become infected by the virus if you touch an object or surface that was recently contaminated with respiratory droplets containing the virus and then touch your mouth, nose, or eyes. Cases from the fall semester at Pitt. Most transmission was from close contacts and unmasked events, including roommates and housemates, the most common, social gatherings without physical distancing and masks, eating or drinking together unmasked. Classrooms were not a significant source of transmission. Clinical activities were not a significant source of transmission. What is Pitt doing about COVID-19? Our university has implemented several measures, including implementing and requiring adherence to health and safety guidance, installing additional hand sanitizer dispensers, more frequent cleaning of frequently touched surfaces and common areas, managing arrival and departure times to thoroughly disinfect common areas and promote social distancing, placing signage throughout buildings to remind everyone of proper preventive measures, deep cleaning and disinfecting facilities, and limiting the number of people in spaces. What should I do to keep myself and others healthy? The health and wellness of our community is a result of the dedication of everyone at the university. The following practices will help support the health of your families and our local and university communities. Arrival at Pitt, shelter in place. Pitt requires all students, including students living off campus, to shelter in place upon arrival. Sheltering in place means staying in your room or residence as much as possible. You may leave for work or to run necessary errands, but always wear your face covering and follow health guidelines for physical distancing and hand washing. The COVID-19 Medical Response Office sends email updates every Tuesday and Friday. Please read these updates for more detailed information regarding shelter-in-place guidelines. If you live in the residence halls, your resident director will be in contact with more specific guidelines. Students in residence halls should stay in their pods during the sheltering period for any activities or interactions with others. Your pod is the small group of students you live with or near in your residence hall. Students who live off campus should limit their social interactions to a small group of roommates or friends who also follow Pitt's health guidelines. Follow signs on campus. Please look for and comply with all signage. Practice these personal hygiene tips when in public or on campus. Wash your hands frequently with soap and water for at least 20 seconds. If you are unable to wash your hands with soap and water, use antibacterial gel with 70% alcohol. Wear a cloth face covering when in public, on campus, or in situations where you may be near people. When sneezing or coughing, cover your nose and mouth with the inner angle of your arm or use a disposable tissue. Don't touch your face, including your mouth, eyes, and nose. Use these instructions for proper hand washing. Wet hands with water and enough soap to cover all surfaces. Rub hands palm to palm, also with fingers interlaced for 20 seconds. Rinse hands with running water. Dry your hands thoroughly with a paper towel from a touchless paper towel dispenser. If you are unable to wash your hands with soap and water, use antibacterial gel with 70% alcohol and apply it with the proper hand washing technique. Remember to wear a face covering at all times when you are indoors, except when in your own room or house. Wear a face covering outside and in public, especially when you may be around others. Face coverings must be worn over the mouth and nose to be effective protection. Practice physical distancing. Keep a distance of 6 feet between people. Avoid physical contact such as hand greetings, kissing, and hugging. Avoid going to crowded places. Avoid contact with anyone who is sick. Limit the use of elevators. Follow signage outside of each elevator that specifies the maximum number of individuals who may ride at one time. Please take the stairs if you are able. Avoid face-to-face gatherings. Use virtual meetings when possible. Do not congregate in common areas or corridors. Maintain physical distance when waiting in lines. Off-campus guidelines. Remember that you represent Pitt and that you are a member of the larger community. Wear your face covering whenever you leave your residence to help protect community members. Know and follow the county health guidelines in your area and continue to wear masks and practice physical distancing at social events. Always practice and encourage others to behave responsibly on and off campus. On-campus housing expectations. Wear a face covering while moving in and whenever you are in the building. Practice physical distancing. Pay attention to all communications from Panther Central and your RD. Reach out to your RA or RD if you have questions. Be respectful of all and care for your community. Building service employees in facilities management and housing administration are cleaning and disinfecting high-touch surfaces and common areas more frequently for everyone's protection. Follow travel guidance. Review the university's guidance on travel and commuting at the coronavirus.pitt.edu website. Avoid traveling when possible. Carefully consider risks of travel both within the city of Pittsburgh as well as outside of the county, state, and the country. It is strongly recommended that you quarantine for 14 days after travel prior to returning to on-campus work or classes. Quarantining means truly not leaving your house or dwelling. Self-monitor. Self-monitor daily for symptoms. Stay home if any COVID-19 symptoms emerge. Are you experiencing any of the following symptoms that you cannot attribute to another known health condition? A new fever, 100.4 degrees or higher, or a sense of having a fever? A new cough? New shortness of breath? A new sore throat? New muscle aches that you cannot attribute to another health condition or that may have been caused by a specific activity such as physical exercise. New respiratory symptoms such as a sore throat, running nose or nasal congestion or sneezing. New chills or repeated shaking with chills, or a new loss of taste or smell? If the answer is yes, you may have symptoms of COVID-19. Do not visit campus and stay in your room. Students must promptly call Student Health Services at one of the numbers listed below. Do not go to a clinic, your primary care provider, or the emergency room without calling ahead. It is important to avoid interactions with others if you have symptoms of COVID-19. Student Health will provide guidance on managing your symptoms and accessing testing and other care needs, including transfer to an isolation facility on campus to prevent further spread of the virus. Contact tracing prevents the spread of COVID-19. If you test positive, a student health professional will work with you to identify everyone with whom you have been in contact. Medical confidentiality and privacy will be maintained. Information given to contact tracers will not be shared with student conduct. Your health and the health of those around you is our primary concern. Identifying contacts of someone who tested positive for COVID-19 and ensuring they do not interact with others is critical to protecting our community from further spread. A contact is someone, masked or unmasked, who was within 6 feet of an infected person for at least 15 minutes, starting from 48 hours before illness onset until the time the patient is isolated. If you have been in contact with someone who tests positive for COVID-19, you will be contacted by a member of the contact tracing team. Please cooperate fully. Medical confidentiality and privacy will be maintained. You should stay home, maintain physical distancing, and self-monitor for symptoms for 14 days. In areas where persons confirmed or probable for COVID-19 have worked or visited for a prolonged period, enhanced mitigation measures may include on-site screenings, additional cleaning, and temporary closure. What happens if I test positive? Student Health Service will walk you through your next options, which may include isolating in your on- or off-campus residence, moving to isolation housing, or returning to your permanent home. Isolation is a public health practice used to protect the public by preventing exposure to people who have or may have a contagious disease. It is intended to separate sick people with a contagious disease from people who are not sick. This significantly reduces the risk of spreading the disease. If you are isolated in university housing or off campus, a student health professional will monitor you for the duration of your stay in isolation. Meals, linens, towels, and other necessities will be provided. You may still attend classes virtually. Active bystander. In order to address student compliance with health and safety guidance and to avoid violating the Student Code of Conduct, every university community member must be an active bystander. Support each other. If you notice a known PID affiliate who is not practicing mitigation measures outlined for behaviors on campus, request in a courteous tone that the individual follow expected behavior. If the inappropriate behavior continues, report the issue. Your cooperation is critical to the safety of everyone at the university. What if a PID community member is not complying? Remind the individual in a gentle, courteous tone about the importance of complying with the mitigation measures. If the individual continues to defy compliance, tell your professor, RA, or work supervisor. Remove yourself from the situation if necessary to keep safe. Report your COVID-related concern at the PIT COVID Concern Connection. Example scenario number 1. If your residence hall roommate is not complying with health guidance by not wearing a face covering when they leave their room, what can you do? You may, or should, remind your roommate of the university's health and safety guidance. Ask them to resolve the situation by wearing a face covering. If they refuse, enlist assistance from residence life staff. Example scenario number 2. What if you are living off campus and your roommate wants to invite 25 people to a party? You may, or should, remind your roommate of the university's health and safety guidance. Tell them you do not consent to having the party. Contact Student Affairs for guidance. If your roommate hosts the party anyway, you should not attend the party. Additionally, you may file a referral with the Office of Student Conduct. Pitt COVID Concern Connection. The Pitt COVID Concern Connection allows members of the community to anonymously and confidentially ask a question about Pitt's response to COVID-19. The Pitt COVID Concern Connection also allows members of the community to anonymously and confidentially report a COVID-related concern. Visit coronavirus.pitt.edu and click on Report a Concern to ask a question or make a report. Conduct referral. In both scenarios, or in any other instance when you witness someone putting others at risk and who is unwilling to comply with recommended health and safety guidance, you, as a member of the university community, may file a conduct referral with the Office of Student Conduct. University faculty and staff may also file referrals when students or others do not follow university health and safety guidance, including if students do not wear masks to class. You will find the link to the conduct referral on the Student Affairs homepage. Student Code of Conduct. This violation has been added to the Student Code of Conduct. Fails to comply with guidance set forth by the university, federal, state, and/or local authorities regarding public health and/or safety. The Office of Student Conduct processes all health and safety referrals in accordance with the procedure outlined in the Student Code of Conduct. Any student found responsible for a health and safety violation will receive sanctions ranging from probation through disciplinary dismissal from the university, as may be appropriate. Healthy communities, healthy individuals. Healthy communities are made up of healthy individuals. Pitt has many resources available to help you make a healthy transition to campus while sheltering in place and practicing social distancing, from telemedicine appointments to teletherapy appointments to outdoor yoga and exercise classes. Please continue to take care of your social, emotional, mental, physical, and spiritual health. Student health. Please continue to care for your regular health needs, immunizations, annual checkups, and any other health concerns. Counseling services. This is a season of uncertainty and stress for many of us. Please continue to take care of your mental health and check in with a mental health professional if you think you could use some support. Therapy Assistance Online, or TAO. Visit taoconnect.org and click on the Sign Up and Self-Help with an Institution button, then follow the step-by-step instructions. Watch the quick video to help you navigate the TAO platform. Each treatment program in TAO consists of 6 to 7 highly engaging educational modules, including interactive activities to help you learn coping strategies and resiliency skills. Additional resources. Coronavirus.pitt.edu has the most up-to-date information regarding Pitt's response to the COVID-19 pandemic. Maskup.pitt.edu provides Student Affairs Department-specific information, like information regarding student organizations and events. Finally, www.ehs.pitt.edu provides additional information. The top 3 things to remember: wear your face covering, stay 6 feet away from others, and wash your hands. We are all in this together, and we will get through this together. Stay safe.